Hey guys, Dimitri, and I want to talk to you a little bit about frozen shoulder and a couple of things that I do before I actually put any kind of needles when I'm treating a frozen shoulder patient. So a lot of times what we'll notice with frozen shoulder patients is that they won't be able to really move their arm or their guarding because they want to make sure that they don't feel any kind of pain and discomfort, or somebody tried to move them and they felt so much pain that they're now guarding and they're not, it's almost like in a sling fashion. So what I want to do before I do any kind of local needling is to first loosen up the joint capsule. We know that the shoulder is a ball and socket joint, and in the actual joint there's scar tissue, there's adhesions that form, and we want to loosen that up first before we do any kind of needling here. The way I do that, if you can lay on your back, the way I do that is I have the patient lay face up, and because they're guarding, because they're worried that they're going to feel pain, you want to let them know, like, I'm going to be very, very gentle with your arm. I'm not going to pull it or manipulate it or anything like that, because then they'll actually let you move it around. So what I like to do is get in good posture, and typically there's not a lot of movement with the frozen shoulder. So what I'm going to do is I'm going to find where there's like a bony end range or a stiff end range, and typically it's with severe frozen shoulder, it's typically around here. So what I want to do first is you're going to hold the arm, the humerus, and stabilize that scapula. So what I do is I'll just push together this way, nice and gently. And this is a strain, counter strain type of technique. So I'm pushing together and then slowly kind of separating, just pulling the humerus down because everything's stuck here. So we want to loosen things up first, push together, and then pull apart. And you'll start noticing that after, holding it for about 30, 45 seconds, 90 seconds, and then you start pulling apart, you're going to start noticing that the humerus is actually going to loosen up and come down with you while you're pulling it apart. And you want to do this a couple of times. And typically what ends up happening is that they'll have a little bit more range, and you're going to find a different end feel. So first do a strain, counter strain type of technique, and then slowly pull apart to loosen up the capsule. Once you loosen that up a little bit, you can then just kind of do a little corkscrew where you're going to push, rotate, come out a little bit, push, rotate, come out a little bit. And this is essentially massaging the ball and socket joint in the joint to break down the scar tissue. It's going to help break things up, loosen the capsule even more. You can do a strain, counter strain again. And that's just one of the manual techniques that I do. And then I'll pursue with some acupuncture. So can you lay on your side for a second? And this is just an example. I'm going to use, come a little bit this way. There we go. Perfect. So we typically do the plateau points of T1 through T4 to increase the perfusion. But what I want to do, what's really important here, after I loosen up the joint capsule, I'm going to use some needles that have a colorful handle, just so you can see. Typically the needles that I'll use here are about 3 Sun, depending on the size of the patient, of course, but we want longer needles to get into the joint capsule. What I'll do is I'll do small intestine 9, and I'll go all the way in. Small intestine 10, and I'll try to insert that as much as I can. Sometimes we hit the capsule where it's a little gummy end feel. And then you want to do the anterior points of that. So you're going to go to the anterior, small intestine 9, and then the anterior small intestine 10. And what you can do is essentially, you can kind of find the acromion, the axillary fold, and half it. And again, you want to use a longer needle. I'm just using a colorful one now, so you guys can see exactly where I'm placing everything. And as far as the stim goes, what I do is I cross the lead. So I'll put one here, and then I'll do the opposite on the top. And I'll do another one here, and then another one with small intestine 9. So there's a current going through the actual joint, about 2 hertz typically, and I let the patient rest here for a little bit. You can also alternate between 2 hertz and 100 hertz if you like, but typically that's what I do for a frozen shoulder. I first loosen up the joint capsule as much as I can, and then I actually do some local needling. I'll do the thoracic points to increase the perfusion. You can also do as distal points lung 5 to large intestine 4, and then opposite stomach 38 with the liver 3. And you can of course stim those as well. But this is what we want to do first. We want to loosen up the joint capsule and then actually do our acupuncture local needles. Thanks.